If you suffer from a bulge at your belly button region, you could be suffering from something called as umbilical hernia. I am Dr. Rajeev Pullagura, Consultant General and Laparoscopic Surgeon in Bangalore. So, what is an umbilical hernia? An umbilical hernia occurs at the umbilicus or the belly button when a loop of intestine or the intestinal fat pushes through the umbilical ring, a small opening or a defect in your abdominal muscles. Normally, the umbilicus connects the umbilical cord in the fetus to the mother's womb. Umbilical hernias occur most often in newborn, and about 90% will naturally close by the time the child reaches the age of 5. But in adults, umbilical hernia can have various causes. After birth, the umbilical cord is no longer necessary, and the opening in the umbilical muscle closes as the baby matures. The muscles do not meet completely, leaving a small hole or a gap. This leads to an umbilical hernia. This leads to a loop of intestine or the intestinal fat, what we call as omentum, that moves in and even penetrates between the abdominal muscles, causing a hernia. Umbilical hernia occurs both in infants as well as in adults. Here are some of the common causes of umbilical hernia in adults. Chronic health conditions that raise abdominal pressure cause these umbilical hernias. Example, carrying excessive belly fluid, something we call as ascites. Chronic cough or repetitive cough. Difficulty or pressurizing while trying to pass urine, especially in case of enlarged prostate. Prolonged constipation. You have the habit of pushing while passing stools on a regular basis. Repetitive vomiting that causes increase in the abdominal pressure and leads to hernia formation. Severe obesity that leads to weakness of the muscles that can also lead to hernia. While lifting your child or lifting heavy weights can cause hernias. There's something called as strangulated hernia. This is a red flag sign. What are the symptoms of a strangulated hernia? Severe abdominal pain or tenderness at the region where the hernia is present. Severe constipation or obstipation. We are not able to pass urine, we are not able to pass stool, you're not able to pass gas, sometimes fever, and sometimes the complete abdomen is bloated, and there is a reddish or a dark discoloration or a bulge in the umbilicus region, or you're having repeated vomiting. Normally, we do certain tests to assess how is your hernia and how is your abdomen with respect to an ultrasound, sometimes maybe an MRI or a CT. Now, what are the treatment options for umbilical hernia? Surgery is the only treatment option for an umbilical hernia. Umbilical hernia is treated either via open surgery or a laparoscopic surgery method. In both these methods, we reduce the hernia content. As mentioned previously, hernia content can be the intestine or a fat of the intestine that is called as omentum. After reducing these content, we repair the defect and as well as place the mesh. In open surgery, what we do is this is done normally under spinal anesthesia. A cut is done either below the umbilicus, contents are reduced, then the defect is repaired along with placement of a mesh. Either the mesh is placed above the muscle or it could be placed below the muscle. In laparoscopic surgery, that is normally done with general anesthesia. 2 or 3 small cuts are made in your abdomen and a laparoscope is used where the contents of the hernia are reduced. Again, the defect is closed with some sutures and a mesh is placed internally and fixed with certain special equipment. Laparoscopic surgery has better outcomes associated with less pain, faster recovery and faster mobility. But at the same time, laparoscopic surgery is significantly costlier as the mesh and the instrument used to fix the mesh is pretty expensive. Both these surgeries are normally covered under insurance. Potential dangers of umbilical hernia. A sudden sneeze or a cough can lead to intestine getting stuck in the hernia, and if the treatment is delayed, you will end up with complications where the intestine or the fat, the omentum can go into necrosis. And this will result in us trying to remove the gangrenous part of the intestine and rejoining it. In this scenario, a laparoscopic surgery may not be feasible. Open surgery may be the only option, and we do not place a mesh during this procedure. Hence, there's a chance that you may require an additional surgery at a later point in time. And emergency surgeries sometimes may not be able to have a laparoscopic surgery. You will end up with an open surgery. Sometimes when your umbilicus is bulged too much, we may have to remove your umbilicus. Remember, umbilicus has only a cosmetic indication and it has no functional value. Though umbilical hernias are very simple It may not be a problematic issue, but in case of any emergencies, it always leads to potential dangers. Please consult your surgeon and get your umbilical hernia sorted at the earlier when you're fit and when it is an elective procedure. Always an elective surgery is much better compared to an emergency surgery. If you have any concerns regarding umbilical hernia, you can drop in your comments and you can reach out to me. Thank you.